Assalamualaikum warahmatullahi wabarakatuh and good day to everyone. Have you ever come across any elderly, for example, in your family members? Most of the time, when we talk about their health, we more focus on to their physical health. We are more comfortable to talk about their diabetes, hypertension, dyslipidemia, or even benign prostatic hyperplasia. But when it comes to mental health, we tend to have difficulty to start the conversation because from here on, we need to get more personal with them. Concerning mental health in elderly, 1 in every 4 to 5 elderly actually having some degree of mental problem. This issue should be our concern as this will constitute the disease burden in our population, especially when we are already an aging nation where 9.1% of our population age more than 60 years old. In our latest National Health and Mobility Survey mentioned that the prevalence of depression among our elderly is about 7%, followed by dementia 5% and anxiety about 3%. All of these numbers are expected to double within the next 10 years if nothing being done. Major factors that can influence mental health in elderly mostly associated with isolation and loneliness. Among the reasons for that is they have poor mobility and loss of independence. For example, when we plan for vacation or going somewhere, most of the time we will not consider taking them together with us. Besides, because of their limited mobility and they are less ability to be independent, they also tend to withdraw themselves from all of these social activities. Other than that, changes in their social role also can lead them to isolation as they retire from work, or if all of their children already moved out of home, they will have less responsibility and less function in the society. So this will reduce their interaction with the surrounding. So ultimately, all of these factors will lead them to be more isolated. Let me share with you some of my experience. I've come across an elderly lady who aged around 70 years old. She always come to us with a body ache. Initially, she will talk about her body ache, then she will continue to relate this symptom with other issues like in her family. Sometimes she will shed her tear while telling the stories, then suddenly she remain calm again. One day, I asked about her husband as she frequently mentioned about her husband. What I found out was her husband was not around for most of the day. It is either he went to the farm or to the mosque or being with his friend. So for most of the time, she'll be alone at home. Then I looked for her husband and I found out that the lady always get angry at him and sometimes cry out of nothing. That is why he always find a reason for not being at home for most of the time. Then after I did screening to her, I found out that she did have some depressive symptoms, but when I want to refer her to the psychiatry, they always give the same reason. They can't decide and they need to wait for the decision from their children. This is another example of loss of independence among our elderly. Afterward, we rarely see her again, and at the end, they refuse to seek further treatment from us and they prefer to look for other alternatives. So we can see here that the stigma towards psychiatric problems are still strong in our society. With regard to the need for elderly mental health, public education on mental health plays an important role so that the community can be competent to see the problem in the community, as eyes cannot see what mind do not know. Other than that, we should focus on the expansion of service capacity and workforce development to be beyond healthcare facility, which involve community and other agencies such as NGOs to help in improving mental health in elderly. Now I've come to a conclusion that there should be a various policy that should cover the issues on elderly mental health as we are going towards an aged nation in the next 25 years. This subsequently will help us to reduce the disease burden of the nation. We should encourage the role of community and NGOs to assist elderly to get out of depression by providing environment or platform for them so that they can stay active and move around either among themselves, or we can bring them back to the community so that they can contribute again in whatever capacity that they have. That's all. Thanks for listening.